topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Dallas, Fort Worth. Welcome to another Ask the Experts, where we bring you the top experts in the field of legal, health, financial, and home improvement. You know, people ask us, do you read these texts we send you or the emails? And today's show is going to prove that we do. We have gotten so many requests from our listeners and our viewers saying, you got to do a show on neuropathy. You know, if you've never had it before, you don't know how painful it is, or the tingling, or the loss of balance. And we've actually not had an opening in the Dallas-Fort Worth area for the last 4 years. And we finally got an opening, and we found one of the top physicians in the area of neuropathy. And that's what we're going to be talking about this morning. And as you know, Dallas is my hometown. So I'm so excited about doing a show like this in the Dallas-Fort Worth area. Let me introduce you to our new expert, Dr. Tim Usselton. Good morning, Tim.
Good morning, Steve-O.
Man, it seems like we've been waiting for months for this to happen.
Yeah, I'm excited to get to join you today to talk about neuropathy and all things neuropathy.
Well, first of all, tell everybody about your practice, Trinity Integrated Medical.
Sure. Trinity Integrated Medical is right here in Carrollton, Texas, the suburb just north of Dallas. And we've been in business here since 1999. And, for a number of years, as my business was growing, I kept seeing these people with neuropathy come in, and there was so little that could be done at the time. So it caused me to just want to, increase my knowledge on the subject. So I got board certified, and it took me a while. Back in 2018, I got board certified in specifically the treatment of neuropathy without drugs and surgery. And so now fast forward a few more years, and we run a neuropathy clinic here in Carrollton. And we're seeing patients everywhere from the very, very easy cases to diagnose to the extremely difficult and very severe cases that come in our doors now.
Tim, what other areas of chiropractic do you handle?
So we have three main focuses in our practice. The spine is, of course, the most common reason why people go to a chiropractic clinic, but we are medically integrated, so it's a little different than just what we would call in the industry as like straight chiropractic, where it's hands only. We have various amounts of other machinery and devices that we use. We specialize in disc problems, so we treat treatment of the discs without surgery, without drugs, without steroid shots. And then, of course, neuropathy. And then, when it comes to other things that we kind of have branched out to as we become medically integrated, we treat a lot of joint conditions that like knees and hips and shoulders. We do regenerative medicine here. We treat some medically supervised weight loss. We're branching out now into some IV nutrition that goes hand in hand with our neuropathy treatments, but also just general wellness and ways to decrease systemic inflammation in the body. So it's kind of, our lane has been the musculoskeletal system since 1999. But as we've medically integrated and brought on more providers, it's kind of branched us out into some of these other areas.
Are you doing anything with lasers at all?
We do some LED therapy. That there are some anodes connected to the cell signaling therapy, we call it, and there are some lasers there. But yeah, great for decreasing inflammation and increasing blood flow and those types of things, no doubt.
Now, you identify neuropathy as peripheral neuropathy. Is that correct?
That's correct. So there are various different types of neuropathy, and there's anything that is including the arms, hands, legs, or feet is considered the peripheral part of the body. You got the central nervous system, which is the brain and spinal cord, and then as those nerves branch out and exit the spine, they become the peripheral nervous system. So the most common areas that we see this neuropathy is in the most distal, meaning the furthest away points in the body from the heart. And so it is a blood flowing issue. And then that's why it's very common in the bottoms of the feet or in the tips of the toes as it starts and works its way closer. It goes to the furthest out places first.
No, with this show, what we're going to try to get across to our listeners and viewers is you might have neuropathy and don't even realize you have it. As you get older, Tim, boy, you just, you get a little pain here and you don't know like what is normal. So what is neuropathy?
So neuropathy, and it's funny you mentioned that, because the thing that gets people in the office with neuropathy symptoms is usually after the fall or after the second fall. It's not I feel numbness in my toes, I need to go get this checked. It's I felt numbness for a number of years, thought it would go away, and now I'm falling. And so there's the fear of breaking a hip or something that's, way more clinically significant than what in the patient's mind is just a little numbness in one part of their foot. So peripheral neuropathy is, defined as a numbness, a tingling, a burning, or a pain that is in the extremities, meaning the hands or the feet, most commonly in the feet, like I said. And when it all boils down to it, it is a decrease in the blood flow to the nerves themselves. So if you understand the anatomy of a nerve, the nerve has this sheath around it. And I'll use the example of like any old extension cord laying around the house. You've got the copper wire inside the cord, and then you've got some insulation around it, and then you've got the plastic coating. Right. And so when the decreased blood flow to the nerve happens, it starts to break down that coating. Just like if you had an old extension cord in the garage and you saw a crack in it, you'd say, wow, that cord may be shorted out. And that's exactly what's happening in the nerves in the body. That coating is called the myelin sheath. And without getting too technical, that myelin is made of cholesterol. It starts to break down over time due to injury, due to the aging process, due to several other inflammation type categories of conditions that break down that outer surrounding coat. And it turns out to be just like that extension cord with a short in it. And you might grab it and it zap you. The same thing is happening to our nerves. And our brain is just trying to interpret, what is that nerve feeling? Like there's no fire, but my feet feel like they're on fire. I don't look down and see ice, but my feet feel cold as ice. What's making my brain perceive coldness or hotness? It's the short in that wire. No different than turning on the light switch and the light bulb flickering. And that flicker, you say, there must be a short in that wire somewhere. And it's trying to figure out, is it on? Is it off? Is there a surge? Is there not enough power? And the same thing is happening in our bodies from the nerves up to our brain. And we just don't perceive exactly the way it actually is in reality.
We just got our first text. This is from Herb in Las Colinas. Thank you for bringing the show to us. I've been wondering when someone was going to do a show on neuropathy. Is losing your balance, could that have anything to do with neuropathy?
Absolutely. It's one of the symptoms that gets people in the doors. They start to lose their balance, and they lose their balance because of that sensation in the feet. We've had patients that come in here that say, I'm afraid to drive because I can't feel my feet in the pedals. And I don't know if I'm pushing the gas hard or pushing the brake hard, and I can't move my feet as well as I could before. And it's because that decreased in blood flow makes those nerves not work the way they should. It's very common that balance is a connective connected symptom. In fact, there's one of the codes that we diagnose people with called frequently losing balance. That is one of the major signs and symptoms of peripheral neuropathy, no doubt. Thanks for the question.
Do like 10, 15 years ago, you never heard the word neuropathy before.
Yep.
Why is it becoming so, I hate to use this word, popular now, even though if you have it, you sure don't want it?
Absolutely. And that's a great question. I have seen the rise and the uptick in it. I think it's because, well, there's probably a couple of reasons behind why we didn't hear about it as much before. All of the Western world of medicine here, in the US especially, they don't have an answer for peripheral neuropathy. They will, time and time and time again, nearly 100% of the cases that walk in our doors, they say, I've already been somewhere and they've prescribed me this drug, usually called gabapentin. It's an anti-seizure medication, and that's it. They say there's nothing else I can do for you. And so it's like, well, what do? We just wait around on that
Right.
drug continue to degenerate, and then eventually the treatment is amputation. Right. And no one wants to lose a toe, but the people that have lost a toe or even lost a foot, it started with a numb spot and it graduated and digressed and continued to be damaged until it got to the point to where, there was no salvaging that tissue. So they cut it out. But yeah, as we've learned more and more about some alternatives, things that do increase the blood flow, treatments that do regenerate nerves when they've been damaged, actually reversing this process. Also keeping in mind that, it's caused by inflammation in the body, right? And those spikes in blood sugar with a diabetic person, especially an uncontrolled diabetic person, they have massive spikes and swings in their blood sugar all the time, which leaves all this inflammatory condition in the tissue. And those are like little fires that just pop up. Like the picture over my shoulder here, it feels like the feet are on fire, and it's just like an inflammation happening. And that inflammation is telling you that blood supply to that nerve is not getting there, and that damage to the blood flow decreases its ability to deliver oxygen and nutrients to that nerve to keep it alive and keep it healthy. And when tissue doesn't have oxygen and nutrition, it dies. It's as simple as that.
How do you diagnose it, Tim?
There's a couple of different ways to diagnose it, depending on, a lot of it's dug out from the patient and their history, and doing a good thorough consultation. The causes of it not only include diabetes, but certain side effects from medications. You've got statin drugs that are a big culprit, because statin drugs are used to lower a person's cholesterol. So when they've been diagnosed with high cholesterol, they may be on a statin drug, and now they may have been on it for 10 years. And that statin is lowering the cholesterol. And remember what I said earlier, if you caught it, that myelin sheath that coats around the nerve is made of cholesterol. So if you were to lower the body's cholesterol levels for a long period of time, you might actually be breaking down the myelin sheath, causing the crack in the extension cord, so to speak. So we determine what the cause in this particular person is. Other things could be, let's see, there's long-term uses of something like aspartame, and we all know what that means. That's the sweetener in diet drinks, in zero drinks like Coke Zero, Dr. Pepper Zero, those things that people have said, I've been told sugar's bad for me, which it is. And so I'm going to switch to diet, but now those are sweetened with aspartame, a synthetic. And that is one of the causes of neuropathy. You've got other things like chemotherapy, a person who's gone through some chemotherapy rounds and some medication, and they might then wind up with some neuropathy symptoms. But at the end of the day, about 30 to 40% of cases we diagnose are in the category of idiopathic peripheral neuropathy. Idiopathic just means that we don't know exactly what the cause is. The vast majority of people, that's 60, 70% of people, we've tracked it down. They're on this med. They have had diabetes that's now controlled. All this stuff that has created inflammation in their body has broke down the blood flow, and we can point to that. But again, 34% of cases, we don't know exactly what's causing it. They can't check off any of the boxes that say this is why you got it. So it just takes a very good, thorough history to answer your question. And then there's some testing we do in the office. Obviously, we can test the nerves. We can take x-rays to look for compression. We found that about 40% of the cases of peripheral neuropathy are also coupled with the fact that there may be pressure on one of the spinal nerves as it's exiting out of the spine itself. And so, I guess we're on, on video as well, so I can show this. I've got a little vertebrae here with these yellow things coming out from between each, and that yellow thing is the nerve, and that nerve goes down to the feet. And so if you put pressure on the nerve here, how it's going to show up in your body is a numbness or a pain down there. It's like a garden hose that's running water out to a long distance to a tree, and it's keeping that tree a drip of water supply so it doesn't die during a season of the summer that doesn't have good rain. And if you put a brick on the hose, what happens? The tree way out there dies. So
Yes.
if you press the nerve at the back, at the lower back as it exits with a bad disc or degenerative changes or misalignment or wear and tear, then it's going to kind of show up with numbness and tingling down in the feet. So we can test that as well as far as determining how we diagnose it. We can look for compression. Another thing is we should look at a person's metabolic health. If they're maybe, alcoholism is one of the causes. So we can talk to a person about that alcohol they're consuming on the norm, regular, day-to-day stuff, it's converting to sugar and causing a massive amounts of inflammation. So we kind of look at the metabolicness, the metabolic structure, the actual structure of the vertebrae, and then we can test the nerves as well. There's something called a punch biopsy that we've done hundreds of times in the office, where they actually go in and take a little nerve tissue, about a half the size of a grain of rice, and we send it off to a lab. And at that lab, they can look at it and they can see the morphological changes, they're called, in the nerve itself, and say you have it or you don't have it. It can be diagnosed with or without symptoms even. So there's lots of ways.
I got to tell you, Tim, I am so amazed where your industry has gone. I mean, think about it. 10, 15 years ago,
Sure.
An auto accident injury. You all are so much more sophisticated now with everything you do. I mean, it could be weight loss,
Sure.
just a lot of different areas of wellness. It's just amazing what your area of medicine does now. I'm so impressed. So now that you decided this person does have neuropathy, how do you treat it?
Great question. That's the $100,000 question.
Yes.
There, right? So
is everybody different?
everybody is different. Sometimes, they might have a small patch area on one foot versus the other. Sometimes it's both. Other people have let it go so far that it started as a small area in the foot, and now their whole entire, from the knee down may be completely numb or completely on fire, or they've gotten to where they can't wear socks, or they can't even cover up at night in bed with a sheet because of the irritation. It just kind of it makes their brain go crazy because they're sensing all of this stimulation. They can't handle it. They can't walk on a carpeted floor versus a bare tile floor because the sensation is just too off for them. But yeah, the treatments include anything and everything. Without going into the specifics of it, it's anything and everything we can do that will ultimately increase the blood flow to that area to get those nerves to wake back up, because the nerves have a blood supply, and the blood supply brings in the nutrients and the oxygen. Without nutrients and oxygen, the tissue is bound to die. So, those could include combined electrochemical therapy. We do cell signaling therapy. We use some LED light sources, like you mentioned earlier when you asked about the laser. A lot of it, we will look at a person's nutrition, because the health of the soil is vital to the repair or the regeneration or the healing of the tissue. When we're born, we have all of these regenerating cells in our body. I mean, the most we're ever going to have is the day we are born. By the time we're age 18, we've lost about half of those regenerating cells. They're no longer effective. That's why as we get older and older and older, we think back, man, I used to heal so easily when I was a kid. Well, by the time we're 60 years old, which, commonly neuropathy starts to happen in the later stages in life. By the time we're 60, those regenerating cells that help our body heal naturally, they're down to maybe 5% of what they were when we were born. So you think about it, that's a steep downward curve in just a short amount of time from, fully maximum to half when we're age 18 to less than 5% by the time we're age 60. And so there are some treatments where we can take some of those regenerating tissues out of your body with regenerative medicine, and we can concentrate them and we can put them back in. It does a massive job of increasing the cell signaling and the recruitment of all the stem cells in your body into the area to say, hey, fellas, let's get to work. Let's heal this nerve right here. That's called PRP therapy, which we do pretty consistently here in the office. It stands for platelet-rich plasma. Again, it's drawing those factors out of your blood from your body, concentrating them, spinning them down, making them super concentrated to maybe the same level of effectiveness of when you were, say, 30 or 35 years of age, and then putting them right back into the area where those nerves are damaged and seeing the body start to regenerate in tissue. So, I started with the nutrition, and back to that nutrition. Oftentimes, I use the example of two farmers. They've got crops on their land, and their land side by side, and one of them has a great yield and the other one is struggling with their harvest. Well, you see, they got the same rain, they got the same sunlight. What's the difference? The difference is the soil. One of them may be in a good, healthy, Red River sand that produces the sweetest, greatest, largest harvest of watermelon you can imagine, next to a clay filled land where it's just not thriving. It's not growing. The nutrition is poor. So we look at the body the same way and say, are you toxic? Are you acidic? Are you dealing with inflammation and tissue that's bad? And we need to start there. We need to start maybe in the gut to say, are you absorbing the proper nutrients? Because we're going to supplement the B1s, the B6s, the B12s, the alpha lipoic acids, all these things that we know help generate that new growth and new tissue and help the healing process. So there's lots and lots of ways of treatment. We're going to look at it from a structural standpoint. We're going to unpinch nerves if we need to, so that, taking the brick off the hose so the tree can grow. We're going to look at the nerves themselves and say, how can we replenish that nerve supply, rebuild those nerves? And then we're going to look at the metabolic side and say, hey, can we make the soil better? Can we fertilize this ground? Can we make it in an environment that's ready to heal?
Well, Tim, one thing I've just learned from this show is 25 minutes just isn't long enough. I've got so many more questions, but the good thing is you're going to be back again with us next month, and we will be telling everybody when your next show is. We're getting so many texts here from people who are so excited about this show. First of all, let's tell everybody who are listening to the show, because we've been running your phone number and your website for our viewers. Let's give everybody your phone number and your website address.
You bet. The office here is Trinity Integrated Medical, and that is our website, www.trinityintegratedmedical.com. And the phone number here at the office is 972-478-5538. That's 972-478-5538. We have a team of doctors here, board certified in peripheral neuropathy, ready to answer your questions. So we didn't get into it, but some of the treatments we offer to patients can be done in their own homes. So we get patients from much further distances because they realize they don't have to come in to the office on a scheduled out treatment plan. We have those that are more local that do want to take advantage of the shockwave treatments or the combined electrochemical therapy treatments or the PRP treatments. And so they're coming in maybe more consistently over a few months. It's about a 6 to 12 month process, though, to rebuild those nerves. And so we have a couple of different protocols that we can put you through. And if the nerve damage is severe enough, you may get it all. Like, we're going to try everything we can to save those toes,
God, I got to read this. This is a great text we just got in. This is from an owner of a home care company. And they said they have a lot of senior citizens that they care for. And this is such a great show. Dr. Tim, what you're doing is really great, and I've learned so much. And we will start recommending your practice to all of our patients. What a great text.
Yeah, awesome. Thanks so much for that.
Yeah, that's wonderful. Like I said, there were so many questions I still had, but you will be back with us next month. And Dr. Tim, we can't thank you enough. I'm so glad we have you doing our Ask the Expert show.
Super excited for the next one.
Yes, us too. And we'll see you again next month.
You bet. Thank you, guys.
That's Dr. Tim Uselton. What a great doctor. And I guess I knew neuropathy was going to be a big topic. In fact, we're doing another neuropathy show today in the California area. But we're going to go to break, and we come back. We have more with Ask the Experts. Take care.
Bender Remba.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.